Hello, everybody, and I want to thank you very much for taking the time to watch this presentation, whether it's live or whether it's going to be watching a recorded version. This presentation is going to focus on selling Kemper's home health care policy, and this is specifically designed for agents who are selling to seniors or long-term care insurance agents who are tired of declines. So my name is Jesse Slome, if I can forward the slide, and I'm director of the National Advisory Center for Short-Term Care Information. I am going to be your guide today at really what is an exciting product. And the reason that I call it exciting, of all the products that agents have been selling under us for short-term care, this is the product that they are selling the most often and the most well, when I say the most often, the most frequently. And so we're going to cover the sales opportunities, and I'm going to share with you what real agents are doing, why they're having success, and I'm going to focus for those long-term care insurance agents who sell to their clients where this product fits into the mix of products and why LTC agents are enjoying selling this product. It's what I call why agents love it. And here's what the Kemper home health care product is, and here's what it isn't. First, it's a great prescription drug reimbursement benefit, and I'm going to cover the significant benefits that you'll see there. It's a home health care benefits product that can provide some value, and some significant value in many cases. Yes, it's a modest home health care aid benefit, but here's why agents really love it. It's incredibly easy to apply for. You're going to see there basically 4 underwriting questions, a total of 5 questions. It's awfully affordable. In some states, it's what I term a no-brainer, and you know, if you're in North Carolina especially, I'm going to show you the rates. What it's not a substitute for traditional long-term care insurance when someone can health qualify and afford coverage, but it is a very viable option when those 2 conditions aren't met. Lastly, it's from Reserve National Insurance Company. That's an A- rated company, and that makes it really important in the scheme of things. Here's the other reason why agents really love it. It is incredibly easy to communicate. This is a screenshot of the entire little printed brochure that's used, and basically, as you can see, 2 sides, 6 panels. It explains everything, the benefits of the product and even the rates. And something that's easy to sell today is really a godsend for many agents. And lastly, I think as I'm talking about why agents love it, I said that it was easy to apply for. This is basically right off the application. And as you can see, there are 5 questions, the 5th one being, do you acknowledge receipt of the outline of coverage? If you answer correctly for the 4 questions, the 4 health underwriting questions, you have a 98% chance of having the client approved. So here's why you're going to love it. I've just cut and paste out of the actual brochures 3 rates, and I want you to focus on where I think this product really is most suitable, which is the senior population, what I'll call the Medicare eligible population, those folks who are 65 and older. This policy will accept applicants up to age 85, but just look at the rates for someone who's age 70. In North Carolina, the annual premium for someone who's age 70 is $169. In Georgia, Alabama, it's $339. In Illinois, it's going to be $434. So the premiums range based on the state that you're in. In some states, like North Carolina, as you'll see why in a second, it literally is what I call a no-brainer. But the bottom line is, as you'll see as I start talking about what agents are saying to their clients, this is a very affordable option for consumers, and with only a few questions to ask, I think you can understand why we're seeing some significant sales growth. The policy is available for sale in 31 states as of today's recording, and the District of Columbia. I'm going to talk in general about all states except Texas. The Texas Kemper home health care product is significantly different, and if you're listening to this in Texas, that's great. You know, many of the basics are the same, but we're not going to focus specifically on the Texas policy provisions. You definitely should learn more. Agents who are selling in Texas also love this product, and it's a little bit richer in terms of benefits, and that's what they like about it, but it is different, and you have to understand that. Now, I started off by saying that one of the key benefits of this product is the prescription drug benefit. And clearly, if you ask the Kemper people, they will tell you that is what they perceive as the #1 benefit. So you look and you say, especially for those of you who are listening, you say, whoa, wait a second, prescription drugs, that's either covered by Medicare Part D or people have plans. You know, why would somebody be interested in a prescription drug benefit? And here's the simple declarative statement. If you take prescription drugs costing more than $300 a year, you should be interested in looking at the Kemper home health care product. And millions of seniors, and this is the slide that I'm showing you here, just talks about the top 10 drugs taken by Medicare enrollees. The green bars on the right show you that 8 million people take medication for pain, 7 million for cholesterol. These are just similar, individual drugs. When you add up all the drugs that are taken by seniors, millions, and you know that, millions and millions of seniors take multiple drugs every year, and these drugs are expensive. Okay, now, yes, sometimes you can get, formulations that, or generic drugs where they're cheaper, but on average, a one-year supply of Lipitor is $871 a year, and these are all reports from national studies out there. So there are millions of seniors where their drug bill adds up to more than $300 a year. You can get reimbursed under the Kemper home health care policy even if you're reimbursed for your drug costs, even if Medicare pays or some other source pays. If you submit and I'll explain in a second what, if your clients are taking drugs costing more than $300 a year, they can get reimbursed up to the policy limit. So let's talk about what this specifically means. You need to ultimately check the state-specific rules that apply for the policyholders or the applicant state. But in general, most of the states have a $50 deductible and an 80% copay with a $250 maximum per policy benefit, and that's $250 per policy year. Some will have a $300 maximum, but I'm going to use the more conservative, the $250. Kemper pays based on the price shown on the client's receipt, even if the person is reimbursed. I know that sounds too good to be true, but that's actually how they apply the claim benefit on this. So if your prescriptions, this is what you would be talking to the prospect about. If your prescriptions cost $300 or more a year, you're going to submit your receipts, and that alone could cover all or much of the premium of the cost. And then, in addition to that, there's the home care benefits, which we haven't talked about yet. So if you look at the right-hand side, if you understand why I said it's almost too good to be true, in North Carolina, a client age 65 to 70, the North Carolina premium for them is $169 a year. The maximum drug reimbursement benefit is $250 a year. But let's look at Illinois, because many of the agents who are working this are in Illinois, and they're still having success. So the premium there is going to be $434 a year, but the maximum drug benefit is $250. So the prospect, if they're taking prescription drugs, and obviously if they submit for reimbursement, will be getting a fair chunk of their premium back before they're even considered any of the other benefits. So very simply, here's all, this was actually prepared by someone for their agents to help their clients get reimbursed. But again, Kemper it's very easy. All one has to do is submit their detailed list of prescriptions and the pharmacy receipt, or the date purchased and the cost for each drug. Now that requires sometimes, drugs are, submitted online and person may not get a receipt. So then they just have to get a list from the pharmacist. They may have to do that little bit of extra work to get it, but it's well worth it to get reimbursed. And in fact, we've had agents who are buying policies on themselves in North Carolina to test the system, or buying it on their parents, and they are reporting that the policy is working and that everything is happening. The client can submit all at once or periodically. I asked Kemper, the only thing that you must be aware of is that they have to submit within the policy year. Otherwise, so you have to, have some control over your timing. Now, you can buy or you can sell 2 home health care policies to a single individual. So yes, they could get the maximum for each. Yes, this has been confirmed by Kemper that they could literally get paid 2 times for the same prescription. And again, I want to always put the caveat in there that this, that my presentation is subject to corrections and errors. If you're watching this, and we'll try and obviously keep everything up to date. But this is the latest confirmed by the company itself. So, in addition to the prescription drug benefit, this is a home health care plan with indemnity benefits. This screenshot that you're seeing is right out of the brochure. And indemnity benefits, especially for long-term care folks, are something that you longed for back in those days. This policy will reimburse an indemnity benefit, an amount of money, up to a daily benefit of $150 when the client uses home health care benefits, skilled services, okay? Now, and you can see what they are. Physical therapy, occupational therapy, respiratory therapy, or even skilled nursing care. These services must take place in the home from an approved provider. Okay, so that is an important caveat. But we are going to see in a second some of the misconceptions that, many people think, people don't get their care at home, but they do in many cases. There are state variations regarding this benefit, as you can see on the right. 18 states have a 3-day prior hospital stay requirement. You're going to see some data coming up because a number of agents have said, well, that excludes a whole lot of people. And the fact of the matter is I did some research on what the average typical hospital stay for a senior is. 13 states have a 0-day prior hospital confinement. And all states have a 60-day maximum benefit. This is a significant benefit for a consumer who looks and says, I understand. I know someone who was in a hospital, and when they came out of the hospital, they had some physical therapy. They had some occupational therapy. They had some skilled nursing care that was required. This is a significant benefit for people who want home health care. Now, as I said, the home health care services must be provided in the home. They're paid even if they're covered by another source. So that means even if Medicare has paid for the home health care services, the person can still get reimbursed. Let's explain what this means, what kind of services are covered, and how it basically works. So yes, if you're selling to people, older people in particular, you understand and they understand that many therapies are provided at home after an illness or to speed recovery from an injury or after surgery. Okay, some require or some try to incent people to go to centers because it's cheaper for them to get therapy there. But people all want to get care in their own home, and even if they're going to a center, they may use this policy to augment the care that they're getting there and get some additional care in their own home. And the home-based therapies allow individuals to develop their independence, you know that, and it allows families to be closely involved in the rehab process. Lastly, so people want to get home care. This policy allows them to do that. They want to sometimes get additional care than what would be provided in a formal center. And Medicare may limit. You know that Medicare currently limits coverage, and it will continue to probably limit more coverage in the future, as people kind of watch costs. So here you have some coverage that gives you the best of all worlds, because it will give you coverage if Medicare doesn't cover. It will also reimburse you if Medicare does. Now, I'm going to look at just a couple of examples to help agents understand how to communicate this and information so that you understand the potential market for a benefit like this. So physical therapy is typically applicable for someone after a fall. They lose their balance, they have joint or back pain. This is directly from the physical therapy trade organization and their data and research. It's very common after hip or knee replacements, a stroke, or heart attack. The average hourly rate for physical therapy at home, $31 to $57. This is currently as of 2016. So you go back to this policy. This is an indemnity policy that pays $75 for one treatment at home. So actually, this policy would provide a significant benefit for someone because it would enable them, people look and go, well, it only covers X amount, but it literally gives you, if you've exhausted the benefits of it, you still have cash in hand, so you actually can extend it. And again, don't forget that you can have two policies. By the way, a little bit of statistic, the average age for the first heart attack for men is 64, for women 72, and certainly heart attacks today are survivable, and one of the reasons that people need some form of physical therapy following that. Same thing for strokes. Almost 800,000 people suffer a stroke. 3/4 of them are over the age of 65. And one of the conditions that strokes, cause is difficulty speaking or swallowing, so that you may need some speech and language therapy. Again, the average hourly rate for a speech therapist, $71. So a policy like this would allow someone to either go to a center where it would be covered, let's say, by Medicare for a period of time, but if they needed more and it was beyond the Medicare, or even if they wanted some additional and they now had a speech therapist coming to the home, the average rate's $71. A policy like this would cover it. This is an important point before we proceed to one of the more utilized benefits, which is the home health care aid. And certainly folks who sell long-term care insurance, this is one of the features that they look at either positively or negatively. So I'm going to address a key thing that I've heard from agents who are selling this and who like it. You can sell two policies to the same individual. And I'm going to read it right off the slide. When you do, each is a separate policy. Each will reimburse for the same benefit. No coordination. Now, the deductibles and limits still apply. So you have two policies. One rehab treatment that takes place in the home. The individual qualifies for two benefit payments. Two policies sold. They have one home health care aid benefit for 20 days. That equals $40 a day plus $40 a day on the second policy times 20 days. And here's a tip actually from the Kemper or from some agents who are doing it. They have a very simple online app that you can use. Have the client sign the app electronically and start the second application, and the personal information's pre-populated. So not that it's a difficult app to do, but I thought that was a worthwhile tip. So the home health care aid, this is the number 2 most used policy benefit. A $40 a day benefit times 60 days, which is the maximum, is $2,400. That is not a huge benefit. I understand that. So this is what I'm going to address now, because here's what I hear from many long-term care insurance agents. When we started to talk about the Kemper product, or when they read the brochure or the outlines of coverage, the comment that came back is, I won't sell this because 60 days is not enough. Or I won't sell this because $40 a day for home health care is too little. Here's what I say to you guys if that's what's going through your head. Okay, objection number 1. I won't sell this because 60 days is not enough for a home health care aid benefit. So we just did some research working with leading long-term care insurance actuaries, where I asked them to research the percentage of home health care claims and how long they last that are less than 1 year. Because typically the data always talks in years, never in months. And these are policies assuming a 0-day elimination period, so that the claim would happen right away, which in this case is the most relevant data. You can see the number right up on your screen. 30% of home health care claims are less than 3 months, 10% 4 to 6 months, 10% 7 to 12 months. So 50%, this is the data that we've always talked about, 50% of claims are less than a year, but a third, almost a third, last less than 3 months. 60 days is 2 months, okay, but a significant number of people, 60 days is going to be enough coverage. And we're going to get to the end of, again, remembering this policy is ideal when people cannot health qualify, when they've aged out or they can't afford. So first, for people who say, I won't sell this because 60 days is not enough, I want to directly say, you're wrong. For many people, their claim is going to last no longer than 60 days. And so this policy will be enough. I won't sell this because $40 a day is too little to provide home health care. Well, first, you can sell 2 Kemper policies. That's $80 a day in benefit. But remember, this is a policy for those who will never health qualify for traditional long-term care insurance, or even a short-term care policy that has more than 4 underwriting questions. So this is an affordable amount of coverage for those people, and you'll see some lines from agents. That's $4,800 in potential benefit. And remember, you also have the prescription drug and you have those other cases. The third objection that I talked about earlier is I won't sell this because in my state, a 3-day hospital stay is required for the home health care aid. That is true. But I went online, I looked at the Department of Health and Human Services, the CMS 2014 stats of what's the average stay for Medicare patients. And these are short stay hospitalization. So the average stay in 2012 was 5.3 days. Now, granted, that means some people will stay less than 3 days and some people will stay more, but when you look and you go, I won't sell this automatically because they'll never meet the 3-day hospital stay, many, many people will. And I pulled up one other statistic because some of you watching this sell Medicare Advantage coverage. So I found this rather interesting. If you kind of look at the arrows, especially for the 65 years and older, because again, I think this is really the sweet spot or the ideal target market for this product. The average hospital stay, whether it's a medical stay or a surgical stay or an injury-related stay or a mental health stay, just look at that chart, that little column, the third column on the right, anywhere from 4.7 to 8.1. So you're going to qualify for that home health care aid policy many, many times, far more times than many of you actually think. So this is a policy. Now, so far, I've been talking about what I would call the core benefits of this policy. When you look at the application, or when you look at the brochure, you will see that there are extra benefits that are available. I'm showing you on the right, before I even talk about the benefits, the chart on the right, I always look at the dollar signs, are the rates for Georgia and Alabama. So the base policy in Georgia and Alabama, everything that I just talked about, the prescription drug, all the therapies that are covered as an indemnity benefit, and the home health care aid, for someone age 70, $339 a year. For someone age 70, for an additional, whatever, it works out about $150. Actually, I guess I wrote it down here, $142.40. They can get the home health care policy with extra benefits. And 34%, so a third, of all the policies sold by Kemper over a recent period of time within the last year included these optional extra benefits. Here's what they cover. They cover an annual physical exam, okay, and not in the first year, but in the second year. So that's worth, up to, well, you basically get $150. They cover lenses and frames, and I will tell you, I don't know anybody who's over age 65 that isn't wearing eyeglasses, lenses, and frames, and even if whatever is covered, this is a benefit. Hearing aids, I know what my mom pays for her hearing aid, and while $250 doesn't come close to the total cost, it's certainly better than nothing. And an in-hospital private duty nurse of up to $80 a day. All of these for that little bit extra benefit, especially if you're talking to people, seniors who wear glasses or use a hearing aid. I will tell you, this is definitely something I believe is worth tacking on to their coverage, because they will get benefit from it. And if you're still not convinced by everything that I've been saying about why agents are having success, it's worth a minute for you to just look at the 4 questions, with the 5th question being simply an acknowledgement to the outline of coverage. The 4 questions that are yes/no questions that make up the underwriting portion of this policy. So, do you have any health insurance? Do you intend to replace your current insurance? Are you living in a nursing home or assisted living, or currently receiving home health care? Are you physically unable to perform? If the questions are answered correctly, 98% of these policies will be approved. And that is, at the end of the day, something that is so important for you. This is literally a screenshot taken off the Kemper. We'll talk about that at the very end. Has a great website where you can, see download material and see completed applications. And basically, this is a shot of the application. It is, if you use the paper app or if you use the online app, I think, as some agents are telling me, is easy to use, but it's a little bit more involved, and that's okay. It's certainly very, your choice, but it's as simple as this. I mean, this is not complex by any stretch of the imagination. Okay. Let's talk for the last couple of minutes about marketing strategies from agents who are selling this product. This slide I'm repeating for those agents who are selling in North Carolina, because if the dollars sound too good to be true, they're true. You look and you go, somebody basically up to age 80 who takes $300 of prescription drugs, they're going to get their medications reimbursed equal to the premium. Now, they have to submit their receipts or the documentation, obviously, in order to get reimbursed. And you can thank, part of the reason that the rates are so low in North Carolina is thanks to the Department of Insurance. But it is true. And if you are in North Carolina, or if you know other agents in North Carolina, they should be looking at this product and selling it to anybody they know who is a senior and who takes prescription drugs in particular. Now, I literally went out to, we have about 130 agents working with us who are selling the Kemper product, and I went to some of those who are having success, and I said, in your words, what are you, what are you saying? What is it that that you're either saying to clients or that makes you enamored with this product? And I'm just going to read you the quotes because that will emphasize it. First, Kemper may be the only place a client or a prospect can health qualify. I've recommended Kemper when the individual is only interested in home care or if they're extremely budget conscious. And you know that you come across people, as when we hear from consumers calling us every day, they are looking for home health care and they're concerned about the cost of what they've read about traditional long-term care insurance. And not everybody can afford or will afford what traditional LTCI policies cost. Here's what one of them is saying when I asked her in this particular case, what are you saying to people that you're talking to, clients or prospects? I hear you want to stay at home as long as possible, and based on either your health or budget, this is the only product on the market that will help you do that. It may not be a perfect solution, and I agree. I think you have to add that in, but it gives you a plan to turn to when you need it. I might also add that it's one of the few products in the industry that allows you to stack two policies and access double the daily benefits per day. People, consumers like that. They like the ability to know that they can actually double their coverage. I recommend it knowing someone can't qualify for regular LTC or short-term care plans with more benefits that have more underwriting. There are lots of great short-term care plans, and some agents have even said that they couple the Kemper plan with another short-term care plan. I would say those folks are more specialists who really spend the consultative time with agents, and that's great. That's where this definitely fits in. But many of them are just doing this when they know the client can't health qualify. Another agent is having success when they're hearing from clients today who are older. They bought their long-term care insurance when they're late 50s, their 60s, now they're 72, 75, and they're seeing people who are needing long-term care, but the 90-day elimination period on their policy is a hindrance. It's a hurdle, and they haven't even focused on the 90-day certification, which keeps a lot of people from claiming benefit on traditional long-term care. So when a client calls or when they're calling, they are adding the Kemper policy to cover that 90-day elimination period. This is a very affordable way to do that. Another agent is saying Medicare, they're talking to their clients. Medicare is paying less. They're sending people home earlier, and while physical therapy is often given at a facility, that's because physical therapy at home can be more costly. Not always, but the view is often that sometimes the center is owned by the doctors or owned by the hospital or owned by the practice, so they sort of, this is where you have to go. But also because physical therapy at home can be more costly. But if you have this coverage, you have the option of getting physical therapy at home or adding physical therapy sessions at home, and that is something, again, that will resonate with customers. If a client uses the plan, say for 10 days of care following a hospitalization, and everybody who's 65 or over today knows somebody who was in the hospital, then came home, needed a little bit of care, but then they didn't need it for the next 6 months or a period of time. If you don't need care for the next 6 months, the policy restores. That is a key benefit. The home health care aid is valuable. When people come home from the hospital, they often need just a few hours of care. This is the term I like to use when I'm talking to consumers because they understand it. I call it wake up and tuck in services, which basically means somebody comes to the house for an hour or two in the morning to get you up and out of bed and functioning and going and get some of the food out, make sure you've taken your medications, and then they need the reverse at night to get you back into bed. That's where you don't need a home health care aid 24/7 or even 8 hours a day. Many people can suffice with wake-up or tuck-in services. This is an ideal policy that will cover that care. I love this quote from an agent. There's so little risk, meaning cost risk in this, it'll give you peace of mind if you need some care at home while you're figuring out next steps. Again, as I always tell everybody, and this is the perfect lead into that quote, it's not a complete solution, but it is a big help to the family. The ratio of premium to value is huge. That's for the engineers in the crowd. If I, as the agent, have a spouse who was declined, meaning that you're a long-term care agent in particular, and you know that the spouse was declined or will be declined with no other option, this is a big help to the couple. And this is that key point, that's why I put it in quotes. The agent, even with the double word can, it can save the agent from losing the sale to the healthy spouse. If you sell long-term care insurance for a period of years, you know what happens. You go back to a couple and you go, nope, only one of you will qualify, and then they both look and say, well, then neither one of us, we're going to show that insurance company, neither one of us are going to buy this coverage. We'll show you. Well, at least this gives you an option to help the couple and save you losing the healthy spouse for traditional long-term care insurance. And there's so little cost and risk in this, it'll give you peace of mind if you need some care at home while you figure out your next steps. So that's an overview of the Kemper product, how it works, how you can start successfully selling it, and I urge you, if you've been watching this, to start doing it. So if you're not already appointed with Kemper, you should ask your GA or FMO, to get you some, or the National Advisory Center for Short-Term Care Information is appointing agents who want to successfully sell the Kemper short-term care product as well as others. You can get more information on doing that by calling the 818-597-3205 or email Mindy Hartman, mindy@shorttermcareinsurance.org, and we'll be more than happy to help you, support you, and get you started down the road towards success. If you are appointed and you haven't visited the Kemper agent website, you must sign in, because basically everything that you're going to need is there. You're going to just follow, the arrows there aren't on the side. I put them down there so that people can look. You can get information on the home health care product. You can get all the state-specific applications, brochures, and forms. And I will tell you, this is such an easy product to communicate to your prospects that you really have nothing to lose by bringing it up. And after you make your first sale and see how easy it is, I promise you, you will start to replicate it again and again and again. And lastly, one of the benefits for agents who are appointed under the National Advisory Center for Short-Term Care Information is that we create generic consumer marketing tools. And the next one that I'm going to focus on is going to specifically focus on taking a look for seniors at a policy that offers a drug benefit if you're taking more than $300 worth of prescription drugs a year. So when you sell a policy, you should connect with us, and we will create a personalized marketing tool specifically for your use. It'll have your name, your designations, your phone number, your contact information, and we will send you an electronic PDF that you can print out and you can use, or that you can email to others, because ultimately we want to make it easy for you to be successful, and for you to be successful selling short-term care insurance, especially starting with the Kemper home health care product. So I want to thank everybody for watching this presentation. I hope you found it valuable. I hope that you will take the next step and either sell more of this or sell more short-term care. If you have particular questions, you can feel free to email me. My email address is right up there, jslome@shorttermcareinsurance.org. Or you can call the advisory center, and as I say, we are happy to help those agents who are appointed and working with us. Thanks again for watching. I wish you lots of sales success.